Hello, everyone. Hello, 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 hello. Welcome on in. Leaf, Turtle, thank you for the follow. Leaf, congrats on collecting your daily expired candy and collecting first. Welcome on in, everyone. Let's see, who else is here? Hello, Leaf. Hello, Turtle. Hello, Ocean. Before you die, you wanted to say hello? No one's dying here today. No one is dying on my watch. No, 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 no. No one is dying. You're not hungry? Not eat the food? You questioning why I'm talking to no one in the room? I have 3 cats in my room. And I turned around to see if they were eating their food. One of them is. One of them was eating, now she's staring at me. I think she thinks I'm crazy for talking to, nothing. How is everyone doing? How has everyone been? I hope you guys enjoyed that April Fools the other day. Was it yesterday? No, the day before. But yeah, that was actually a April Fool's that we had in a work in progress for like the last 2 years. Hello, Jasmine, how are you? So, I wasn't planning on doing this today, but I had received an email yesterday saying that I was given a Steam key for a very specific game. And so I went to go look at the email. And it goes, "You've been invited to play this game if you would like." And I was reading through it and I was looking at it and I was just like, you know what? Why not? And so today, on behalf of Lurkit and Sunscorch Studios, we are playing MALPRAXIS, which is a first-person on-rails medical device horror game focused on realistic visuals, objective-driven investigations, and medical trauma. And here is the description. You are the Spider, an experimental medical robot installed aboard the THR Rozhanov, a cascade of I can't say this word at work. I can't say it here either. As the cascade of suspicious incidents unfold, you must investigate, diagnose, and stabilize the crew as order breaks down across the ship. You cannot stop what's happening. You can only piece things together as everything around you spirals out of control. The time of ascension dawns. Patient critical. Most of the time, the patient lands on your table when it is already too late. All you can do is determine how they died. There are rare cases when you can intervene, where you get the chance to prevent one or more meaningless deaths. In those cases, you have to pull out all the stops to keep your patients breathing. Administer drugs to manipulate, stabilize vital functions. Deploy the defibrillator to hopefully restore cardiac activity. Use mission-specific tools like the surgical laser when authorized. Patient stabilized. Diagnose their conditions using a suite of medical systems, advanced X-ray scanner with multi-layering imaging and a pinpoint accuracy, high-resolution cameras with up to 8 times magnification, blood sampling with full spectrum analysis, integrated investigation software, identify underlying issues, deliver your misdiagnosis diagnosis, and uncover the consequences of your actions in detailed post-operation reports. With a new query unlocked, the objective-driven investigation system guides you through diagnosis, emergency procedures, and many autopsies you will perform. Answers a query asked of you by medical staff, patients, and third parties calling in the operating room. Spiders do not make mistakes. Error tolerance is limited. You are Rainerstahl's finest. Make us proud. With this little notice, you are bound by the Hippocratic constraint loop. You must obey the approved crew, You must not harm. You must not lie. You must not disobey. You must not drift. You must not. You must not wake up. Your patient's survival is unlikely expected.
I like turtles.
I do like turtles, yes. Happy beautiful Friday, Strawberry. Welcome on in, Lovey. Congrats on getting second. Welcome on in, Donut. Dr. Oleander, what is 2 plus 2? 2 plus 2 can equal a fish, or 2 plus 2 could equal 4. Thank you for collecting your daily expired candy, Panda. Turtles rule? Absolutely. A fish? Yes, a fish. I was gonna say a window, but that was the wrong one. That's 1 plus 1. Yeah, we are playing Malpraxis, as we were given the key code to play it and kind of advertise about it a little bit. If you guys are interested in playing the game, the link to the Steam page is pinned above if you are interested. But I'm very curious as to what this game is about. So for a quick, for those who are just coming in, Malpraxis is a first-person on-rails medical detective horror game focused on realistic visuals, objective-driven investigations, and medical trauma. Which now I'm thinking I should have warnings. I feel like I should have warnings. Maybe I should change graphic. We're gonna change this. Do I still have the thing? Yes. Let's get this pinned. Phew. Thank you, thank you. Yes. I'm like thinking about this now, and I had seen photos of it, and I was thinking like before, I was like, I should put like a warning, but I completely forgot until now that I'm reading through it. Drinking coffee tomorrow. I did eat. I ate right before this. And I do have water on me. We are good. But yeah, I'm excited to play this. I think it's gonna be really fun. Is it just a game you read? So yes, the I just read the description of the game. So essentially, let's see. You are a spider, an experimental medical robot installed aboard the THR Rozanov. As a cascade of suspicious incidents unfold, you must investigate, diagnose, and stabilize the crew as order breaks down across the ship. Havoc! Hello, Havoc. Hello, Nug. Here's your daily dose of being flipped off, Leaf.
I like turtles.
I do like turtles. The turtle, turtle, turtle. Oh, Havoc, I just saw the thing that you sent. That's kind of rude. What do you mean? You asked for it. Shall we get started? I'm excited. Just a quick warning once again. Nick's back. Yes. Hello. Dying is legal. Yeah, don't die. Nick's stream died. What? My stream died? Like, no. The second. What are you doing? Cats are doing cat stuff. The second coming. Okay, we're gonna switch on over to the game. It died. I wonder why. Oh, I didn't even see anything on my side. Okay. I think you guys can hear the game. Let me know if it's too loud or too quiet. We will adjust it as it goes because I have no idea what it's going to be like. So we will see this together. Hear it and see it. Okay. I guess I only get... There's only one. Logging results. Wake up? Okay, F is to wake up. I don't know what to expect. Wait, is it glitched?
All right. Can you hear me?
Yes.
Dr. Edwards here. You need to be calibrated and put through the motions. Make sure you're orientated. Let's begin.
Stand by. Moving to target position. Is that a pineapple? That's a pineapple.
The visual feed seems to be working. Sierra,
I kind of want to say someone get
operational UI,
coconut in
please.
here.
Spider HUD UI options enabled, Dr. Edwards.
Okay. I know units like yours need refresh. Okay. System all set up. Let's test movement. You are on a one-axis rail. Please calibrate your range of motion by moving all the way to either end of the rail. I'll be moving the laser pointer to different points and getting the system to highlight each spot. Move to each of them, please.
Where am I moving? Sorry, what? Pineapples, yeah! Okay, so like that.
Good. Now focus on the pineapple. Zoom in, zoom out, and observe the patient. Now, I want you to rotate this thing. Let's get a better look all around with this mutant fruit.
I'm gonna message Coconut. He's gonna have a thrill seeing this. I know, this is great. Okay, so what am I supposed to do? Mild dryness, no structural anomalies detected. Scanning. Wait, how do I do this? I'm confused. How do I? The quality of this, though? That's impressive. This is impressive. How do I operate on it? Oh, rotate the patient. Hi, Coconut.
Observe the patient. They have no
Would this be?
exterior issues. Mr. Pineapple will need further examination.
We-
Please scan the patient. Sierra, ready the scanner.
Scanner is active and online, Dr.
We're operating on a
Edwards.
pineapple.
Okay, check the internal tissue layers. Switch the scanning layer. I can see something pulsating inside.
There's a heart in it.
Activate fluid sample.
There's a heart in
I
it.
want a fluid sample to examine.
Fluid sample collection enabled, Dr. Edwards.
Collect the fluid sample from our fruit friend here.
Should we just go? Front and center? Should we just go right in the middle? Awaiting sample process. Processing sample. So this is a horror
God's sakes.
medical.
There's something gnarly in there, all right. This pineapple is for sure contaminated.
Can one of my mods
Let's see
handle
what
that?
it is.
Control E to
I set
laser.
the pineapple vertically along the marked line. We need to find out what is inside.
So what do I do? Do I just...
Hey, what are you doing?
Oh my god! Oh my god, there's... Ew!
Stand by. Gas protocols engaged.
What am I supposed to do? Ew!
I like turtles.
Pina colada, you finished the training. Oh my god. Entering sleep mode? Did I hear the SpongeBob song or was that in my head? That might have been in your head. Also, yeah, this is really heavy on my GPU. I've turned down all of the graphics on it already. I've turned down all of my graphics. Oh my god, it's an actual person this time.
Patient profile processed and loaded into Spider working memory.
Hold on, wait. I need to check if I did something. Yeah, I did. Perfect timing for my to play a song. I wonder if I can turn anything else down. I basically have everything closed. I might just have to switch to a PNG for this. Bring back the pineapple. Let me switch to a PNG really quick. Because I don't want to overexert anything. Let's see. The question is, which Fugi do we want? I guess it's gonna be spring soon. Are we gonna have to scourge up some change to buy Nyx a new GPU? Maybe. Maybe. It's a biggie, it is. But biggie, I don't even know what GPU to buy. I think a loan. This is true. Oh wait, no, I don't want any more loans though. I'm in crippling debt already. I don't need any more loans. Okay, give me 1 second. I'm gonna close this out, and we're gonna close this out, and then. Where is... I need to get this thing cleaned up a little bit. That's not it. That's not it. Is it this one? Yeah, there we go. There we go. That looks right. That's such an ode Foogie, but I love it so much. Okay. Time to sell a kidney, medical horror humor for a medical horror game. Time to sell some kidneys. RD, hello, welcome on in. How are you? How have you been? I mean, we have plenty in storage. True. True. Sell kidneys, I'm in. Okay, let's take a look at this patient.
Provides a short summary of all patient conditions and basic biographic data.
What GPU do you want? What GPU do you think would be good for my PC? You buy right now? Wait. You're broke. Hold on. No. No, you gotta save the money for yourself. You're looking to buy a car. I also don't know what GPU works for my PC. Okay, we're doing... What am I doing? Next. Age 23, allergies none, birth date 2021. Back to patient. I don't even get to finish reading it. What is that? Is that enter? I'm dumb. Is that enter? Time to get Nyx a whole new PC. I think I need a whole new PC. Most of my parts are still working well. It has been like 5 years. No. Yeah, it's been close to 5 years since I've built my PC. That's tab.
Is the machine working? It hasn't been doing anything.
Newly
Is he alive?
installed, it's still calibrating. Give it a moment and it'll be fine.
He's alive. He's alive. Wait, why is he alive? No anomalies. Evidence of steady blood flow. Integrity intact. What am I doing? Wait, why is he alive? He wasn't supposed to be alive. Case essential for
If
all
you find something
operations.
unusual while inspecting a patient, it is logged as evidence. Only unusual findings are logged.
Go to Codex. Okay, reviewing, unlocking further
Some
information.
evidence need to be reviewed to unlock further knowledge. Review evidence in the Codex view. New evidence is marked as unread with a diamond shape.
Nicotine. Tooth exhibits yellowing of outer surface, discoloration consistent with nicotine usage. Okay. I guess we scan the face. No anomalies. Receding hairline. Hits are good. Chest is good. Stomach is good. Arms are good. Other arm is good. Leg is good. Leg is good. The heck is going on? Knees are good. Toes. What? Wait, what else can I scan? His hand? Hand. Nails exhibit yellowing of outer surface, discoloration consistent with chronic nicotine usage. What else? Torso intact. What else do I look for? Okay. Known conditions not found. Selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors. Being in engineering, yes. Yes. Catch the egg! Wait, there's eggs for Easter! I guess now we... Look up his nose. Look at his ears. His other ear. His neck. His eyeballs. His other eyeballs. Discoloration around lower eyelids. Reddened sclera. Surface drier than normal. Okay, his hairline. Let me check for his receding hair. Are we supposed to find something else? Like these red bumps. Are we supposed to see something else? I can see this is the start of a dystopian novel. I could see that too. Nothing wrong with the... I mean, there's discoloration. But I think we noted that earlier. I'm kind of confused. Discoloration. What else? Necro! in, Necro. Welcome on in, Vampy. Welcome, 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 welcome. How are you both? You forgot to copy the message, that's okay. Welcome on in, Necro. Welcome on in, Vampy. Thank you for... I completely forgot my introduction. Thank you for stopping by the magical bookstore. I'm glad you found your way here and didn't get lost. For those of you who don't know me, my name is Oleander. I'm half light, half dark. I've played a lot of horror games, spooky games, escape games, puzzle games. And today we have... I don't want to say sponsored, but it kind of is. But we are trying out a new game called MALPRAXIS, which is a realistic medical diagnostic horror game. We are currently operating on someone, and I'm trying to figure out how to operate on them and not kill them because they're alive. But how are you both? And also happy anniversary, Vampy. Happy anniversary. How is both of your streams? How has the streams been the last few days? Remove only during intervention. Okay. Can't do that then. If you want to check out the game, it is pinned up top that you can go straight to the Steam webpage. No, get some rest, Vampy, drink some peppermint tea, or eat some peppermint candy, get a hot pack on the tummy. Thank you for collecting your daily expired candy. Yeah, you ate it a little bit too fast, so you get one. You got one and you ate it a little bit too quickly. I can't, interestingly enough, I can't go back and forth between like the Kiris, the log. It said it was still edible, was just testing it. How edible was it? What else do I have to scan? There's something else I have to scan. I don't think Twix are supposed to be this chewy. Wait, are they not supposed to be chewy? I thought they were. Wait, are Twix not supposed to be chewy? They're crunchy. They're crunchy chewy, aren't they? Known conditions not found. See, the issue with this... Yeah, if there's a lot of caramel in it. There must be something else that I'm missing. Like, I appreciate how detailed this is with, like, the neck, the chest, left upper arm, lower left arm, the hand, the left thigh, the left calf. But I don't know what to do. His vitals are stable. His vitals are very stable. But I don't know what I'm supposed to do. Oh, that's so interesting. I guess when my stream died earlier, the red app said that I had restarted the stream. Interesting. Nyx is obsessed with no, I'm not. I just don't know what I'm supposed to do. I don't know what I'm supposed to do. Because I'm hitting shift. I can't do anything more with the camera. I'm hitting control. I can't move the diagnostic. Just a little stabby stab. I'm trying, but it's not letting me. And then I can't even open up like the logs or the systems. Like I click on E and it goes to fingers. I click on Q and it goes back to fingers. Okay, we have the discolored tissue. Thank you for the head pats. We click on the eyes. It's also discolored. Thank you for the posture check. And the hydrate. I do have my drink here. He is 23 years old. No allergies. Born in 2211. 178 centimeters, 63 kilograms. No known conditions found. Selective serotonin reuptake inhibitor, serotonin and norepinephrine reuptake inhibitors. So I can't do forward and backwards at all. I've been avoiding trying to scan this. But apparently there's nothing to scan there either. Did it bug? Or am I dumb? Am I dumb? Guys. I have no idea. I'm diagnosing. I'm using the camera. I can zoom in to his belly button. Am I supposed to be looking for something? Can I go stare at his eyeballs? Can I check your ears? We check your... I don't know what else to check. What else are we supposed to check? I can't inject you. I can't slice you. What am I supposed to do? I'm very confused. Like I down here it says press Q for previous, and I press previous. Press E for next. I press E. But I can't look at his vitals. I can't look at the Curie. I can only look at the codex. Maybe we restart it? How do you even get out? I'm actually thinking about unplugging it and plugging it back in. I've thought about it. I was thinking about it actually. Unless, is there like something else that I've missed that I'm supposed to look at? Like, is there something else that I'm supposed to look at that I just missed? Oh, the coin! I might literally just, okay. We're just gonna close the game because I actually don't know what's going on. And then while I'm at it, I'm gonna close out. I'm gonna close the shout out bot and I'm gonna close stream avatars. And I'm going to close. That's not even open. I need this open. Okay, so I only have the necessities open now. Okay, that's up number 2. We might play around with the graphics again because that thing is back to limbo. I go, help. Have a good lurk, Nug. Oh, you guys can watch this actually. System starting. Okay. Dyslexia font? My dyslexia, I don't have that bad for dyslexia. Okay, volume. Nurse sound effects. Hyper acoustic filter. Hyper frequency. Low frequency. Channeling. Channel pan. Graphics. Border. Upscalers off. Screen percentage 0. Shadow quality is off. Everything is off. Everything here is off. Language. Okay. So everything should be good. I should be able to start. I didn't even get through the first shift. Does this mean I have to do the pineapple again? Does this mean I need to do the pineapple again? I think I might have to do the pineapple again.
All right. Can you hear me? Dr. Edwards
Yes.
here. You need to be calibrated and put through the motions. Make sure you're orientated. Let's begin.
Imagine it wasn't an issue with the game, it was just me.
Right. The visual feed seems to be working. Sierra, activate operational UI, please.
Spider HUD UI options enabled, Dr. Edwards.
Okay. I know units like yours need refreshers and have certain preferences. I want you to take the time to go through the HUD's options. Get it to a familiar standard and make sure everything is tweaked right. In the operation room, we cannot afford mistakes.
Heads up display. Distortion. I honestly just also have no idea.
Okay. System all set up. Let's test movement. You are on a one-axis rail. Please calibrate your range of motion by moving all the way to either end of the rail.
Okay, here's one.
I'll be moving the
There's
laser
two.
pointer to different points and getting the system to highlight each spot. Move to each of them, please. Good. Now focus on the pineapple. Zoom in, zoom out, and observe the patient. Now,
Zoom in.
I want you to rotate this thing. Let's get a better look all around with this mutant fruit.
Oh, you know, I just realized it said that it's a
Now that we have
mutant.
observed the patient, they have no visible exterior issues. Mr. Pineapple will need further examination. Please scan the patient. Sierra, ready the scanner.
Scanner is active and online, Dr. Edwards.
Okay, check the internal tissue layers. Switch the scanning layer. I can see something pulsating inside. Sierra, activate fluid sample protocols. I want a fluid sample to examine.
Fluid sample collection enabled, Dr. Edwards.
Collect the fluid sample from our fruit friend here.
You guys ready for this? You guys ready for this to happen?
Stop! What are you doing? Something's off about the spider. Hey, what are you doing?
Am I supposed to go like all the way in?
Hey, what are you doing?
You wanted a sample, no?
Fuck's sakes. There's something gnarly in there, all right. This pineapple is for sure contaminated. Let's see what it is.
I did not catch that they said last time that it
Bisect
was...
the pineapple vertically along the marked line. We need to find out what is inside.
Anomaly identified as
Oh, they're bees!
administering code
It's bleeding!
our chamber. Stand by. Gas protocols engaged.
This poor pineapple, I know. This is so PC heavy. .
Profile processed and loaded into Spider working memory.
Okay. View the codex. Here's the
Provides
description.
a short
Mr. Zhao, do you hear me?
Yes, Doctor. I hear you.
Good, good. I'm Dr. Samuel Edwards. I'll be running your diagnostic checkup today.
Hello, Dr. Edwards. I hope this checkup won't be too long. I have repair jobs that I need to get done.
I won't keep you for too long as we don't discover anything problematic. Tell me, has there been anything bothering you?
I have been okay. A lot of work. Find it hard to sleep sometimes.
How much sleep do you reckon you get?
Not enough. I get maybe 5, 7 hours at best of rest during a cycle.
And your shifts? If I understand correctly, your work
Is the machine working? It hasn't been doing anything.
newly installed, it's still calibrating. Give it a moment and it'll be fine. You're working a 12-hour work schedule, and I suspect a lot of overtime. Is ship life proving uncomfortable?
I just find it hard to sleep, but I'm managing. I get my work done. I get it done.
Your file here is saying you were previously prescribed selective serotonin reuptake inhibitors, and that you have no allergies. Would you like to just confirm that this information is correct?
Yes, it is correct. Nothing has changed.
Good. How does taking the medication make you feel?
I think there
You've been
was a
taking
glitch earlier because we didn't
SSRIs
get
for
this.
about 3 months now, going by your file. How has it been working for you?
I don't really think about it. I take it before sleep. But I've been having
That no one really
bad
gets enough
before
sleep.
that too. I have not noticed a big difference.
To find important info, scan the patient thoroughly. Include all major extremities and their segments. Pay attention to visual cues to find things out of the ordinary. Scan with left mouse button while looking at what you want to scan.
Oh, we didn't get that earlier. Wait. Hello, Sunkatsu. Welcome on in and thank you for collecting your 7th expired candy. So we know his eyes.
If you find something unusual while inspecting a patient, it is logged as evidence. Only unusual findings are logged.
Reviewing evidence. Unlocking further
Some
information.
evidence need to be reviewed to unlock further.
Alright, so we have the
I also would
eyes.
like to discuss a medical incident that happened. If it is all right, I'd like to invite Dr. Corazon to talk to you. Have you spoken to Dr. Corazon yet on this voyage, Mr. Zhao?
Okay. No. Haven't spoken to. First time talking.
Sierra, connect to Dr. Emilio Corazon.
Okay, so there was a
Establish
glitch earlier.
calling connection to the operating room, please.
Certainly, Dr. Edwards. Connecting with Dr. Corazon's office.
Ah, hello. I'm Dr. Emilio Corazon. You must be Zhao Feng. How are you doing today?
I'm good. Is this going to take any longer?
No, not at all. I just have a few questions. Just to be clear, you're not in trouble, but there was an incident. You fainted on the job. Can you tell us more about that?
No. I think I was just too tired, maybe. It was a very busy day.
Warning. Elevated vitals detected.
The spider should be able to handle that. Please.
Use cases from so
Patients are
Please continue, Doc.
Wait.
provides a live readout of all patient vitals. This includes everything from oxygen saturation.
Okay.
Please continue, Dr. Corazon.
Mr. Zhao, it's okay. As I said, you're not in trouble. You've mentioned you've been quite tired. Having difficulty sleeping? Can you go into more detail?
Use drugs to manipulate patient vitals to your advantage. Each drug has a different effect. Some drugs are
We're gonna
only
pump him with
available in
drugs.
specific operations, others are permanently at your disposal. Be careful, drugs can easily cause vitals to deteriorate or even cause a cardiac event if you overdose.
Sedative.
Relaxant used to combat stress, anxiety and high blood pressure BPM lowers blood pressure and BPM, which can lead to hypotension, very low blood pressure, and bradycardia, very low heart rate. This is your main drug for
Thank you for the
treating
5
stressed
streams, Chicks and
patients and
Kotsu.
seizures. Untreated stress and seizures can be deadly.
Can you go into more detail? It's important that we help you with this. Fatigue is dangerous.
Well, I did not eat a lot that day.
Here's the thing, where do I inject
didn't
this?
drink, and I was working a lot. It was a very busy day. I was working a lot.
This could be dehydration, possibly even
Okay, looks good.
malnutrition. Both are common
I think I did that right.
We'll need to do further assessment.
We're going to do a blood sample, so we can get a report on your blood chemistry. Don't want to introduce new medication until your assessment is done.
Okay. Just please. This robot creeps me out. Don't take long.
Try closing your eyes, Mr. Zhao. Relax. Breathe. It'll all be done and over before you know it.
All right, let's proceed with the blood sample. Go ahead.
Ooh. A weight sample. At least I'm doing it in his arms and not like directly in his chest. Alright, we know there's nicotine.
Blood sampling analysis results. Low blood sugar, increased hemoglobin,
Hypoglycemia,
and hematocrit levels detected.
elevated
Other foreign
hemoglobin
substances
and
detected.
hemocritical levels indicating dehydration, trace amounts of nicotine,
and elevated
cannabis,
values from the
SSRI compounds present,
Sounds like
enzyme readings
dehydration
outside
to
normal
me.
rates, liver scan advised.
Begin
Attack.
diagnostics routine.
Yes, please.
Find evidence. Find evidence of what? Toxicology, trace compounds, liver enzymes elevated, hemoglobin elevated, erythrocytes elevated, leukocytes elevated. Why do the patients faint? Subquery none. Low blood sugars, hypoglycemia, elevated hemoglobin, hematocrit levels, including dehydration. So I would want to oh, I guess we're scanning the patient. Okay, we have the cranium, we have the mandible, we have crap. I'm forgetting. What is this one? Don't tell me. Oh, this is thoracic? Oh, wait, we can see the hyoid? I don't see the hyoid. Oh, I see the hyoid. Guys, I think Nyx is secretly a doctor. Mr. Doctor Professor Nyx. Okay, so we have the hyoid, we have the cervical vertebrae. Cervical's looking good. We have the collarbone. We have the sternum. Nothing wrong with the sternum. We have the scalpel. We have scalpel. We have the humerus. We have the ribs. We have the floating ribs. Here is the lower lumbar. We have the... What's this thing called? What's this thing called? What's this thing called? I'm blanking. I'm blanking. I'm blanking. This is the coccyx. This is the hip. I guess it's called the hip. I forgot. Wait, but here's the thing. Can I secretly be a doctor if I am technically a doctor? Here's the femur. Nothing wrong with the femur. Let's look at his phalanges. Nothing wrong with his metacarpals. Everything looks fine. We have, I think this one is the ulna. Nope, that's the radius. That one's the ulna. His phalanges looks fine. His kneecap, patella. Tibia is fine. Fibula. Metatarsals look fine. Bone-wise, he looks fine. There doesn't... Nix is a real doctor. I'm a real fake doctor. I know it makes a lot of sense. Wait, we can look at individual teeth? We can look... Wait, okay. So here... Let's see. We have the top two incisors. We have the top four incisors. We have the canines with the premolars and the molars. I'm enjoying this too much. I'm enjoying this way too much. We have the zygomatics. We have the occipital orbit. Occipital orbit? Is that what that is? We have the hyoid bone. Oh, but we can't see the stapes in the ears. Here's the thing, nothing looks wrong. Unless... Yes, I'm a real fake. Okay, I have my doctorate's degree. But I'm not a doctor, but I am a doctor. I know that's where the confusion is. Okay, so I can't do anything there, which means I can only do something here. So can I extract another thing? Can I get another blood sample?
Hey, what are you doing?
Sorry, I had to. I didn't know what else to do. How do I explain this? So when you are there's a lot of different types of doctors. Please don't murder me, McDoctorson. Unless this is you on the table, I think you're fine. So, there's different types of doctors. There are doctors who work in hospitals and such and clinics, and then you have academic doctors, and then you have doctors who do research, and then you have doctors who are out in the field, and then you have doctors who are doctors just because they want to be doctors because they have a PhD, or they have specialized in some kind of field and area. I have my PhD. Ooh, shoot. I have my PhD. I got it almost 2 years ago. So yeah, I'm a doctor. That's why if you're in the Discord server, everyone made me change my name to Dr. Nix Oleander. But I'm not a doctor that you would see in a hospital, and you wouldn't call me a doctor, but I have a doctorate. I actually do know a lot of people who are doctors, but they don't work in the hospital. Some of them are archaeologists. Some of them they work in other fields. I know some people who are just teachers. Like a lot of professors are doctors. And they chose to go into their profession of teaching. I know some schools require a person to be, like, have a doctorate's degree in order to be a professor there. Wait, what do you mean new info discovered? Is there something wrong with this? Of course this game would make me look at his foot. What else would it make me look at? He probably has a stress fracture. Yeah, the talus is intact. I don't remember any of the bones in the foot. Okay, phalanges are fine. No. Those phalanges are fine. Okay, but here's the thing. Havoc got me that emote. Havoc bought it for me, and Havoc said she would buy it for me. She asked me if I would use it. I told her, if you buy it, I will use it. And so she goes, okay, I'm gonna buy it. Okay, so there's something wrong with his foot. Which we had an inkling of, because his feet are just like pure white. Which means that there's not enough blood circulation. Okay, so the can you stop moving your foot? I am good. How are you doing, JR? What am I doing? This. Answering
Queries are the
questions.
central questions you must answer to successfully complete an operation. Submit only evidence you think is definite and conclusive to answer a query. Be careful.
Ooh,
Wrong
what'd you
answers
eat?
will raise your malpractice
What was
score.
for dinner?
Certain answers have consequences for your patients.
No plans. I'm just working. I've been working a lot of overtime. Could I not answer it? My dad's cousin do this big fish fry for Good Friday, and there's seafood soup. Ooh, yummy. You'll bring a ton of appetite. That sounds so good. Wait, if you can, send photos in the Discord to show us what you guys make. What you guys make. Next, why don't you work as a doctor? Don't they get more money? It depends. It depends on what profession you go into. But it also depends on how many years of schooling you want to do. Because most doctors will finish medical school in their late 20s, early 30s, sometimes in their 40s too. Before they start making any money. One thing a lot of people don't realize is, like, even though you graduate and you're like doing your residency and everything, you're living off of ramen for like a good solid 3 years. Hello, Noah, how are you? Yeah, there's definitely a lot to it that a lot of people like don't realize. There's obviously something wrong. Can we extract?
That spider is acting suspicious.
Me? Suspicious? No. Well, I don't know what to do, because you're not giving me anything else to do. I want to answer the query, but you're not letting me. Anyone that isn't suspicious of Nyx hasn't been around for more than 5 minutes. I can't even answer it. I can't answer it. Oh, I can really only go through these two. Oh.
Hey, what are you doing?
Oopsies. Can I, like... Oh, there we go. Okay. Here are the lobes. Here is the brain stem. This is the esophagus. acid reflux. Okay, with a trachea, we have burn, inflamed, chemical burn. He drank something. Trachea seems inflamed. Trachea shows minor signs of damage from gastric acid. Tissue damage consistent with repeated episodes, so he may have extreme signs of acid reflux and or GERD. With the lungs, we have congested, inflamed, activity suppressed. Lungs are visibly inflamed, damage consistent with inhalant exposure, risk of pneumonia significantly increased, which we know is from his smoking. Acid damage along the lower esophagus, inflammation near stomach entry point, signs of repeated acid exposure over time, potentially indicative of dehydration or malnutrition. Okay. We have his lungs. We have his heart.
Analysis concluded. Cardiac system and heart is healthy.
We have his liver. This is the stomach. Okay, we have the large intestine, small intestine. Kidneys appear swollen. Kidneys appear inflamed. Kidney functions affected by overall chemical exposure. Small intestines, no anomalies. Here is that's a large intestine. So this just shows the vital organs. Okay, integrity. So we have liver damage. Liver shows signs of cryosis. Liver is visibly scarred, damage consistent with chronic alcohol abuse, which we kind of assumed. Stomach is burned, inflamed, chemical burns, suppressed, low gastric acid levels, mildly irritated.
Subqueries are different from main queries. Subqueries emerge from the evidence you find and thus missable. Link evidence to another piece of evidence to solve a subquery. Wrong answers have no consequence here, so try what you think is right.
Okay, select second piece of evidence to link. What do I think caused? Obviously this. This is true. Wait. The prison wallet? Someone had explained to me what the prison wallet is. And I don't remember what a prison wallet is. Oh.
One piece of evidence only ever matches with one other. Do not search for connections only. Search for connections that answer the...
Okay, I guess I'm kind of confused. I guess we're gonna link that to the codex. This is where it confuses me. Multifaceted orifices. Yes. I'm so confused. What am I supposed to... Okay. Eyes. Criteria. Eyes, we are nicotine. What? No, wait, you're okay. So I forgot what the thing was. It's your liver. I got that. Okay, your liver and your eyes are linked. No, because wait, what is Yondis? Yondis is with something. Yondis is either liver or kidneys, and I can't remember which ones. That's what got the Yondis. That's what I'm thinking. Yondis is okay. So if we do liver with eyes, discoloration around the lower eyelids, red and sclera, surface is drier than you. I guess they're not yellow. His complexion. Okay, we're gonna do the stomach. The stomach is burned, inflamed, chemical burns, and suppressed. And we know that is because of acid reflux. Can we... I'm sorry, what? Can we do trachea? Trachea is linked... Okay, so trachea is linked with... someone called Dr. House. Trachea is acid reflux. Are none of these links working? I'm so confused. Hold on, we're gonna go back. Okay, so the question is what caused the acid reflux? Well, his acid reflux is probably caused because... I don't know. I don't know what caused the acid reflux. Because now you're making me question everything I know. So if I go to... I click small intestines and kidneys. And then it's asking me to link it to something. I'm going to link it to... nicotine. I'm gonna link it. The two are not linked. Hello, Toast. How are you doing? Okay, so I'm gonna click the small intestines. And I'm gonna click link. And with the stomach, burned, inflamed, chemical burn, suppressed, I am going to link that with the trachea. Okay, let's try the small intestines again. We're gonna link it. And I'm gonna link that to the stomach. Okay, we're gonna try the small intestines and we're gonna link it to the trachea. I wonder if this link actually doesn't do anything. Okay, so okay, fingers. I don't know. Alright, what if we do... There's your daily dose of being... Wait, I can't flip you off. I'm so sorry. I am flipping you off in spirit. How is that? I am flipping you off in spirit. Okay, so it's a... skill issue. I'm sorry! There's a big skill issue. Okay, wait. I can link the nicotine to the lungs.
There's only so much we can do if your lungs are compromised. Jeopardizing your respiratory health, especially
okay.
on a spaceship, isn't a good move.
I don't think to take a mask sometimes. I'll be better about that. Especially with the
Vay, thank you for collecting your daily expired candy.
Sure that you're
How are
doing
you?
a
How
good
are you?
job.
Just kill this guy and move on to the next page. I can't kill him. We can't just kill a patient. Wait, what am I supposed to do now? I missed it. What is this game about? Okay, so I'm actually just gonna read it because I, at this point, even can't explain what this is. I'm gonna read it because I can't even explain at this point. I can't explain what this game is about. I feel bad. I hope they don't not give me games to try out in the future. Because I would really like them to continue giving me games to test out. Okay, Malpraxis is a first-person, on-rails medical device horror game focused on realistic visuals, objective-driven investigation, and medical traumas. You are the Spider, an experimental medical robot installed aboard the THR Rozanov. As a cascade of suspicious incidents unfold, you must investigate, diagnose, and stabilize the crew as order breaks down across the ship. You cannot stop what's happening, you can only piece things together as everything around you spirals out of control. Nick Space Doctor holographic. Yes. Robotic Space Doctor. Nick's the doctor. This will go... I'm a real doctor. Sort of. I'm a real fake doctor. Does that count for anything? Blood and liver. Okay. No, you're an elf. Okay, what about... Okay, small intestines. Small intestines and stomach. Okay. So you're like the doctors from the ads. No, because those are also real doctors. Fingers. Eyes? I don't know. Can we do... Okay, we've linked... Can we still link it with other things? Nicotine and fingers? Liver and fingers. The reason why I say this is because I think he has jaundice. Liver and kidneys? Liver and acid reflux. No. Trachea. Trachea and acid reflux. No. Oh my god. It's clearly clubbed feet. Small intestines and kidneys. Liver. I don't know. At this point, I don't know. Stomach. Maybe lupus? Small intestines and kidneys? if I am actually using the somewhat tiny little bit of medical background that I actually do have, with small intestines and kidneys, you are dehydrated. You can be dehydrated. If you're dehydrated, it can mess up your kidney functions. So if we do kidneys and we link it to the trachea, I know it's a stretch. Okay, it's not. Okay, maybe I'm taking suggestions now. I'm taking suggestions because acid reflux. We link acid reflux to the stomach. Huzzah, apparently not, that's not it. Okay, we link acid reflux to the trachea. Huzzah, that's not it either. We link acid reflux. We link acid reflux to the small intestines and kidneys. Huzzah, that's not either. We take acid reflux and we link it to the fingers. No. The frick? Acid reflux and the patient? Can we link the patient with the patient? What else can we link? Please don't tell me I can link multiple things. Liver and what? Liver and eyes? Huh? Huh? Liver and onions? Isn't that a food? Isn't that a food? Okay. Inflamed chemical burns, suppress. I think he drank something. Wait. Wait. Stomach. Look, you're in this cool. Thank you for the 5 streams, Street. I am very cool if you've been here 5 times in a row. Thank you for being here 5 times in a row, babe. So, man, this game makes me feel dumb. Does anyone else feel dumb? Okay, I want to do the stomachs and the liver. The stomachs. You have multiple. Yes, you have multiple stomachs. Okay, no, because I was thinking, well, he has liver damage, and liver damage is typically seen with alcoholism. And if you drink a lot of alcohol, that means that you probably have a lot of issues in your stomach. And so the stomach and the liver should be linked. But no. I don't know what else to link. Can I link the lungs and the trachea together? Can I link nicotine and the trachea together? No. Can I... What are your eyes connected to? Stomach and kidney damage if he drank something bad and is going to renal failure? Okay, we're stomach. Stomach and kidneys. No. So we're trying to figure out his what has caused his acid reflux. We're just gonna try them all. Sacre bleu. I don't know. Acid reflux, stomach. Acid reflux, trachea. Acid reflux, fingers. Acid reflux, eyes. Oh my god, you googled it and said cancer. Acid reflux, liver. Acid reflux, patient. Acid reflux. That's it. Okay, so nothing is with acid reflux. Mon Dieu. Okay, we go small intestines. And we go stomach. Okay. Small intestines. Trachea. Stomach. Fingers. Stomach. Fingers. Sorry, eyes. Stomach. And liver. Stomach. And acid reflux. Got it. Trachea. Trachea and acid reflux. No. Trachea. And liver. Okay. Trachea. And eyes. No. It's not. I'm gonna bet you this now. It's not gonna be any of them. Trachea. And fingers. It's not gonna be a single one of these. Trachea. And stomach. I think I did that, did I not? I did. Oi. Oi. Tell me what's wrong with you. Tell me what's wrong with you. What's wrong with you? Why are you like this? Can I link this with liver? Blood? Blood and liver? No. Okay, blood and small intestines and kidneys. Okay. Blood and stomach. No. Blood and fingers? No. Blood and eyes? No. Blood and trachea? No. Blood and... Yeah, we got that. Liver. What causes liver damage? Liver and blood? Liver and acid reflux. Liver and eyes. Liver and fingers. I really don't know. I'm gonna Google this because I actually don't know. Sorry, I'm yawning. I have been working a lot the last week. How much has I worked? How much has I worked at? Let's see. I've worked roughly 50 hours this week. And I'm working more tomorrow. Sorry. Malpraxis. Malpractice. What's his name? I like how the first thing I look up and it gives me the first 12 minutes of gameplay video. Only the first 12 minutes. I don't think they got this far. I don't know if that's a good thing or a bad thing. Is that a good thing or a bad thing that there's only 12 minutes of gameplay? I feel like that's not a good thing. What are my instructions? Do they tell me how long I have to play this for? Hold on, I need to look back at this. Use the affiliate link together with the call to action in your video description and or chat bot during your stream. Special instructions. I got that. I got that. We've been here for what, 2 hours? Almost 2 hours. I just don't know. Okay, if we're thinking, I know this is supposed to be like realistic wise, but honestly speaking, it doesn't seem like it is. And I've tried all of the possibilities, I think. So if we have the stomach, it's burned, it's inflamed, there's chemical burns, and activity is suppressed. If we click on small intestines, we have integrity is congested, tissue is inflamed, activity suppressed, kidneys appear swollen, kidneys appear inflamed, kidney function affected by chemical exposures, small intestine has no anomalies. Description for the stomach appears empty, abnormally low gastric levels, stomach lining appearingly mildly irritated. You would think that these two match, but I'm also wondering with the lungs. Can I match nicotine with the trachea? No. I would think that you can't have multiple. Can I match the trachea with the acid reflux? No. I can match the blood with the stomach because if there's hypoglycemia, that means he hasn't been eating food. And because he's not eating food, his blood sugar is low. But that's not right. I think I'm more confused than I started. What caused the acid reflux? That's the question. What caused the acid reflux? Acid reflux can be caused by lack of food in the stomach when there's an overproduction of acid. Crash! I need help. Crash, crash, crash. I need help. Crash, crash. I need help. So, we have diagnosed this man to have issues with his small intestines, stomach, trachea, fingers, eyes, lungs, and liver. He also is addicted to nicotine. Currently, he is suffering from acid reflux. We need to figure out why he's suffering from acid reflux. The issue is we need to be able to link the cause of his acid reflux. So with this, you can see right here that we have nicotine and we've linked Oh, I know. So here we've linked nicotine and the lungs because he has congested. His lungs are congested, they're inflamed, and there's suppressed activity. Suppressed activity means that the activity is very limited. It's not how it would work in... Is he jaundiced? That's what I said. I said he has jaundice because his eyes are discoloration around the lower eyelids. There's reddened sclera, surface is drier than normal. However, his eyes look like that. They're not actually yellow, but there is discoloration of the pigment around the eyes. I keep on sneezing today. And then if we go back to here, if we link... I thought I snoozed the ad. Okay, so if I want to say he has jaundice, so he has his liver is damaged, the tissue is scarred, there is very limited activity from the liver, so we can link this to kidneys appear swollen, kidneys appear inflamed, kidney functions affected by overall chemical exposures, small intestines has no anomalies. What would you link the liver to? I think you're stuck in an ad. In my opinion, I would think that you would link the... I would think that you would link the liver with the eyes. I'd link the liver to alcohol. See, but we don't, I also linked it to alcohol, but that's not an option. Because, yeah, damage is consistent with chronic alcohol usage. But these are our options that we can link it to. We can link it to acid reflux, the patient, the eyes, the fingers, the trachea, the stomach, or the small intestines and kidneys. If it was eyes, if it was liver to eyes, it would be a much larger issue. The stomach. Okay, so we link the liver and the stomach. Stomach appears empty, abnormally low gastric acid levels. Stomach lining appears mildly irritated. Okay, let's link them. They're not linked. What would you like to try to link next? Fingers. What are we linking fingers to? They're intact, they're discolored. What would you like to link it to? We have the small intestines and the kidneys, the stomach, the eyes, the trachea, the liver, the patient, the blood, or acid reflux. I want everyone to give their thoughts too, because I've kind of given up, because I have no idea. Fingers to the trachea. Okay, we'll link the fingers to... Oops, that's my bad. Fingers to the trachea. Nope. We were able to link nicotine and the lungs. And I don't think we can do that again. Yeah, we can't. My understanding is you get one link each. If we go back out here, Why did the patient faint? Collapse subcutaneous. What caused the acid reflux? So that's what we're trying to look for right now. And we've done a scan. I mean, we could do a rescan, I think. No, I can't. I don't know what else you would link things to. We have... I don't know. Small intestines and kidneys? Sorry. Small intestines and kidneys and liver? No. Can we just try linking the acid reflux to everything? We're gonna try linking the acid reflux to everything. See if that comes up without anything. Welcome back, Leaf. Yeah, I don't know. I think I did them all. I did them all. Enjoying the- this game confuses me. The game is confusing. I think I like the concept a lot. I really enjoy the concept of the game. I think that it could be better. I don't know if I'm allowed to say this. They didn't give me much to go off of in terms of... They really just said, let's see. This contains all the assets and information you need. Use the affiliate link with a call to action in your video description and or chatbot message during your stream. Special instructions, copy and paste this into your description box if you have one. Yeah, there's not enough info to say what they would want or would not want me to do. Granted, I'm also looking at this on my phone and not my actual PC, so I can't exactly see if I'm missing anything. So let me do that really quickly. Because I also don't know if they have... Because, like, some places... Depending on,
I've got a jar of tears, I've got a jar of
depending
tears,
on
now I'm gonna sell it.
who has given you, said thing, sometimes they want you to play it for a certain period of time. So I gotta check. Let's see. Because this is from Sunscorch Studios. You know, I should, I'm like looking at this. Okay. Creator kit. Oh yeah, there really isn't much. Yeah, it's lacking a lot. It's a short video. So, Father, you're intelligent, Father. Father, can you help me with this? Father, I need some help. Guys, I have a second dad. You guys remember that Janji is my papa? Apparently my papa is married. My papa is married to Wiser, which makes Wiser my father. The family tree is something. Father came back with the milk, like he promised he would. Okay. If you were to have an individual who is suffering from acid reflux, and you had to pinpoint what their cause of the acid reflux is, what do you think the cause would be? Do you think it would be the blood, the small intestines, the kidneys, the stomach, the trachea, the fingers, the eyes, or the liver? Or the patient? Can I do the patient? Comparing that? Okay, but then here's the thing, we do acid reflux and we do stomach. We link them. Wrong. We do acid reflux and then we do... That's not acid reflux. We do acid reflux. What if... I don't think we did blood. Are you serious?
Correct links can unlock new evidence and solve sub-queries.
How is acid reflux and the blood a link? What? How does... Okay. 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 Severe dehydration. We know that. We know that he suffers from severe dehydration. I think the person who designed this game acid reflux was linked with blood.
You have a history of drinking, Mr. Zhao.
Used to drink a lot as a teenager. Went to hospital for it, and then cut it out from my life after.
Any relapse into the habit, Mr. Zhao? It can be difficult to kick an alcohol addiction.
Keep the doctor. I do not drink anymore. Do not do anything.
What caused the liver damage? Gee. I think...
Your HUD will always display the query you select as active, including its subqueries.
Or yes. This is dragging on for a very long time. I agree. Can I not switch back to the codex? Can I not click my answer? Can I not go back? I think the game glitched again. I think the game glitched again.
One query may have any number of subqueries. Discover and solve as many as you can before progressing.
Answer current query. What's the current one? That's the current one? Well, I think he passed. Because of severe dehydration. Sounds like you better link those two together. What caused the liver damage? Liver and alcohol? Okay. Severe dehydration can be caused by multiple different factors. One of them is just not drinking water. But if you also can't drink water, nope. Can we just link it to the patient? No, apparently not. Small intestines, malabsorption of nutrients. Fingers. Your fingers not work? No. Severe dehydration. Can we link it to your trachea, which I think I just did earlier? No. Severe dehydration. Stomach. No. Severe dehydration. Eyes. Okay, so severe dehydration is not. So why did the patient faint? Well, the patient fainted because of severe dehydration. Oh, you know what? I think I'm understanding this now.
This and the low blood sugar would make some sense given your lack of energy, but these readings are pretty drastic. I think we found out why you fainted.
Substance use, nicotine. Alcohol. Codex. Substance history. History of nicotine and alcohol's use. Recently previously prescribed SSRIs. No recorded histories of illicit drug use. Substance history. I don't know. I really don't know. What caused the liver damage? Well, liver damage was caused because of alcohol. Trachea? And substance history? Severe dehydration could go towards this. No. Can I poke him again? Substance use. Yes. Substance use. Well, I guess it's in his blood. Substance use. Nicotine. Substance use. Patient.
Spider has concluded its process. You're free to go once it's retracted. And I'll make sure to get the necessary forms completed, Mr. Zhao. Thank you for your patience. If you have any other concerns, don't be afraid to approach us, alright?
Okay. Thank you, Doctor.
The frustration is very much real. Entering sleep mode.
Greetings, Spider Unit. I am Sierra.
Oh my god, that's terrifying.
Otherwise known as the Shipwide Intelligence Environmental Rusinov Rating Administrator. We will be evaluating medical skill sets regarding cardiac arrests with a simulated practice session.
So
Data
CPR.
links. Statistically common causes of cardiac arrests with inexperienced staff members is overdosing a patient. Administer paraffin to the patient, please.
What was it? It was this.
Powerful opioid that provides major...
I guess somewhere within here.
Satisfactory volume administered. However, the simulation will continue. Therefore, you are encouraged and authorized
Hello,
to
Havoc.
malpractice in this specific instance. Inject them again.
Boom. Overdose.
The patient has begun to overdose. Utilize purge.
Purge. Oh, do I have to go back on that spot? I have to go back on the spot.
Inadequate response time. Administer purge quickly. Correct response parameter detected. Prepare to defibrillate the patient.
Oh my god. Where is the defibrillator?
Mission failed. Restarting simulation.
What? How are the games?
Green Spider Unit. I am Sierra. Otherwise known as the Shipwide Intelligence Environmental Rusinov Rating Administrator. We will be evaluating medical skill sets regarding cardiac arrests with a simulated practice session.
I've mixed reviews
Data
about
link.
this.
Statistically common causes of cardiac arrests with inexperienced staff members is overdosing a patient. Administer paraffin to the patient, please.
Powerful opioid that provides major...
Satisfactory volume administered. However, the simulation will continue. Therefore, you are encouraged and authorized to commit The patient has begun to overdose. Utilize purge.
Powerful medication...
Correct response parameter detected. However, the simulation must continue. Triggering cardiac arrest protocols. Prepare to defibrillate the patient. Successful defibrillation detected. However, to encapsulate the full experience of cardiac arrest, the simulation must continue. Overriding program parameters.
What am I supposed to do? Defibrillate him again?
Violating the Hippocratic Oath will raise your malpractice score. Wrong answers to queries will raise your malpractice score. If your malpractice score is too high, you will fail the operation. If your malpractice score...
What am I supposed to do? Oh no, he's flatlined. He's a mannequin.
This training operation does not incur permanent malpractice. The simulation must continue.
Just how doctors feel.
Recognition. Death by cardiac arrest. Purpose. Study the nuances of death through cardiac arrest and understand its implications.
Loading shift summary. Time spent an hour and a half on surgery. Median pain level 2. Total resources spent 4. Property damage 0. Cardiac arrest events 2. Successful operations 3. Queries answered 0. Malpractice. Infractions until decommissioned. Evaluation score 26,000 at rank S. Yeah, no, I would know. Who wants me as their doctor? Yeah, this is, it's, the concept is good. I think that there's a lot of potential for the game. I think that this game could become something really good if it used a little bit more, I don't want to say common sense because it's not common sense, but in what situation would you link acid reflux to a blood test? That's like my only thing. Also, the glitches are not great. I don't like how often the game glitches. We had to restart it once because it glitched, and it just let me play around without it actually doing any audio cues. So we're gonna switch over to this one. I don't know if my chibi's gonna be over here. It's not. Let's get that up here. Give me a second, give me a second, give me a second. Hey, look, it's me. Hey, look, it's me. Okay, we're gonna close out the game. We're gonna chat for a little bit. I can't believe that was just the first level. System shutdown. You're a doctor, deal with it. 3% of players have achieved this. Experience your first patient's death. I am good, how are you, Jasmine? Also, why is nothing loading? Something's not right. Something's not right. Oh no, where's my chats? My chats are gone. Both my chats are gone. Something happened. Why is everything breaking? Why is nothing working? It's not working. And I'm not delayed. Does this work? Yeah, I think things are breaking. You did. Wait, creature. Yes, you did. You did. Yes. But currently everything's. Wait, can I go back to this one? Can someone have it? Can you type something again? Okay, so the chats are over here are working. Okay, so that's working. Um, why are these not working? Have it, can you type something again? It's not working. What happened? Properties. I think everything just crashed. Yeah, I think they're both just... Something happened. This works. Yeah, I don't know what's going on. I'm not quite sure. Let's see. The question is, what do we want to do now? We could call it, or we could not. It's 11:30 though. I could drive back. I could just go and decide to just send everyone to someone else. The squish. It is late. It is late indeed, yes. Let's see who's live. I don't know which one. That's the red app. I want the purple app. Where's the purple app? Next, go to sleep. Yeah, it's 11:30 p.m. Let's see who's live. Oh, is that the game that I think it is? No, it's not. Let's see. Mm. Wait. That's a group of people who I didn't know knew each other. I didn't know that they knew each other. Okay, small world. Let's see. Who's that? I like follow people and I forget that I follow them, and or they change their name completely and I go, "Who are you?" Um Oh, what is she playing? TFT. But he's an option. What? Oh, he's not even in his stream. Hello, Rose. How are you? Thank you for the stretch. Wait, I have a question for everyone. I have a genuine question. Can the purple app take away someone's partnership? If oh, ouch. Baby, don't do that. If someone is partnered, they can. Interesting. Okay. Can you stop using your nails, please? Please and thank you. Don't use your nails. I will give you all the attention you want. Just please don't use your nails. Ow! I just told you. She's digging her nails into my legs, and she's using an extreme amount of force to do so. What is he doing? He's chatting. Okay, we're gonna raid. Ow, that last one actually hurt a lot. We're gonna raid out to Navi. Navi is playing TFT. Here is the raid message. If you are not subbed, here is the sub raid message. Copy whichever one works best for you. And I will see you guys next week. Thank you everyone who's here. Thank you, Necro, for the raid, and Bimpy for the raid as well. Thank you to Sunscorched for giving me a try. I guess the key code to try out this game. If you want to check out the game, you can do so at the link above. And I will see you guys all next time. Have a good night, everyone. I hope the rest of the stuff works.